where this motion gets so tight that they can't even get their shoes on or their socks on. It's a real problem. So simply do it, maintenance every day.
And the third stretch we're going to do is actually go into hip flexion. You're going to stretch your buttock muscles. So, what you want to do is bring one knee up to your chest. I'm going to leave the other leg flat on the mat here. Again, I'm going to hold this for roughly 30 seconds. You can go straight up. You can try to go in a little bit. You can try to go out a little bit. Just go what feels good. Work, noodle around, as Kelly Starrett, physical therapist, would say. And then you're going to switch legs and do it on the other side. And Brad, you can actually do this in a seated position, correct?
Exactly. And I'll do it here. And this is one point where, we say it's okay to slouch in there. We need to stretch the low back a little bit in that direction. And the noodling that he talks about, I really find helpful, particularly when I go towards or across my body. Make sure you do it with both knees. It's a real nice stretch. Gets that piriformis muscle as well. All right, a third option that I also like for the hip flexion stretch that we just demonstrated in bed or in the chair is use a stairway. I usually go to the second step like this, have something with the handrails to hold on to for stability is nice, and then I'll lean into it. This is more aggressive. It's more for someone advanced or who has done it before, and I like to put the weight in, and I'll actually noodle in here, and boy, does that ever feel good on my hip. It really makes me more ready to start the day. Now we're going to show the one that can be very helpful for arthritis or that torn labrum. Great success with this in the clinic.
So, oftentimes with hip arthritis or a labral tear, you get more pain with actually bearing weight on that hip joint. So, what it's actually doing is putting the ball and socket tighter
Right.
together, and we need to try to stretch it out and make it relax a bit. So, what we're going to do is I'm going to stretch my right leg. This would be the painful side. I'm going to stand sideways on one step, and notice I'm going to relax my pelvis. So, essentially, your pelvis is going to shift and drop. I am now relaxed on this side, getting a nice distracting feeling here. Now, what you can do is kind of swing forward and backwards a little bit to see if that helps. If you're not getting enough pulling or distracting forces and you have a cuff weight, say, you can put this around my ankle like Brad is doing now, and it'll help put more of a pulling force. If you don't have this at home, maybe you have a pair of heavy winter boots, you can just put that on this foot to get the same kind of feeling.
Right. Now, I do want to mention I've had this with a number of patients. When you do this, you figure out how to relax your body and that hip, because that does take a little practice. The relief will be immediate.